If you start to see your cholesterol flagged on your blood work, don't panic. Before you start to panic and go down that Google rabbit hole, pause, see your trusted healthcare provider, see a naturopathic doctor, bring that blood work and start to think about what information do you need? What does that risk assessment look like? And how can we really make some impactful changes at midlife to make sure that we're setting your heart health up for the best that it can be for the decades to come?
Welcome to the Advanced Women's Health Podcast, where we empower women with the latest insights and advice on holistic health. From cutting-edge medical research to practical wellness tips, our mission is to help you thrive at every stage of life. Join us as we explore topics ranging from hormonal balance and reproductive health to nutrition and mental well-being. Whether you're seeking solutions for a specific health concern or simply want to enhance your overall wellness, you're in the right place. Let's embark on this journey to better health together. This is the Advanced Women's Health Podcast.
Hello, everybody, and welcome back to another episode of our podcast. I'm Dr. Mary Ellen Tedeschi, naturopathic doctor and clinic lead here at our Ancaster location, and I am joined today by Dr. Natalie Shear, naturopathic doctor in Sudbury, and we are bringing you a fun-filled, empowering episode all about cholesterol changes in midlife. So this is for you if you are noticing cholesterol creeping up in your blood work, you're approaching age 40 or already there, or even in your 50s. Even if you haven't noticed the obvious telltale signs of menopause yet, we're here to link the menopause changes happening with your hormones along with what's happening with your metabolic health to give you some really good insight into what's changing with your cholesterol and lipids panels, how to be informed and make those proper decisions when it comes to treatment options, and ultimately what you can do about it. So I really want you guys to reframe perimenopause into a window of opportunity for getting into the best cardiometabolic health that you can for the decades to come. All right. So Natalie, let's start by talking about this transition, something that we talk about a lot in practice and with our patients, and just, going through these changes that are happening when we're approaching menopause.
Yeah. So, we know that perimenopause is kind of that critical window for cardiovascular risk assessment. And so we really know that estrogen plays a lot of protective roles in the body. And as we see estrogen starting to decline, as we kind of go through that perimenopause transition, we see a lot of those changes start to happen. And one of the changes that we see oftentimes that's linked with estrogen starting to decrease is that we do see cholesterol changes on that lipid panel. So we see total cholesterol starting to rise. We can see LDL starting to rise as well. And the reason being, one of the reasons is that we know we have those LDL receptors that are at the liver. And we know when estrogen starts to decline, those LDL receptors start to decrease, that activity decreases, and the liver clears that LDL from circulation. And so we often see those LDL starting to rise. And so that's one of the things that we start to see during that perimenopause transition. And I'm sure we both kind of see a lot of women being shocked that they have never had high cholesterol before. And then all of a sudden they're stepping into our office and they say, I haven't changed the way that I've been exercising. I haven't changed the way that I've been eating, but now my LDL and my total cholesterol is higher than before. And I'm not sure what to do.
Absolutely. It's something that we see weekly, if not daily, in practice with multiple women. Often this being the first sign or one of the first signs that perimenopause, we should shift our thinking and treatment plan into one that's going to be really proactive for this transition time, right? And just to break it down, in case any listeners are unfamiliar with what the lipid panel is and what these acronyms mean. So total cholesterol, when you look at your blood work panel, so a lipids panel will have triglycerides, total cholesterol, LDL, HDL, otherwise known or often known as, LDL being your bad cholesterol, your HDL being your healthy or protective cholesterol. And that full panel gives us the picture. So what I always tell patients, just seeing one number, in isolation isn't enough. We need to track the whole panel and changes over time to understand really what's going on. And I love when you said, perimenopause and midlife is a really great opportunity for a cardiovascular risk assessment because let's face it, heart disease is one of the top killers for women, a leading cause of death for women. And we see this transition happen in midlife where all of a sudden that is, outweighing a lot of other illnesses and diseases as a top risk factor for mortality, right? So if there is something that we can do to help change that risk to work in our favor, then we need to be more informed to know what that risk actually looks like for our own lives and what we can do about it. So when we talk about a cardiovascular risk assessment, so we talked about the blood work, the cholesterol panel, the lipids. What else is involved in that risk assessment that we do for patients?
Yeah, in a risk assessment, we always take patients' blood pressure. So we put that in and plug it into the American College of Cardiology cardiovascular risk assessment calculator. And so I take patients' blood work in the office, then I plug in their most recent cholesterol values. So that'll plug in your HDL, your LDL, and your total cholesterol. You'll also put in the patient's age, in addition to their gender that they identify with, and their race as well. It also acknowledges risk factors like smoking, and if a patient is already on a statin or if any kind of aspirin therapy is being taken at that particular time. And it'll give us a percentage of over the next 10 years, how likely is it for a patient to have a cardiovascular event occur. And so we can show this to patients and kind of see what that percentage is for them. And it gives us an idea if we want to kind of go down the route of MHT, if they're a good candidate. And so that discussion is really had because I'm sure we'll get into it in the podcast. We know that MHT, and by that I mean menopausal hormone therapy, the estrogen and progesterone that we use, is something that we need to consider the cardiovascular risk assessment. So that's the tool that we do to kind of like as a preliminary assessment to see if they're good candidates for it.
Absolutely. So that is something that when you're working with one of the naturopathic doctors here at Advanced Women's Health, most, if not all patients, we are doing a cardiovascular risk assessment because we do view cardiovascular health and cardiometabolic health as one of those foundational pillars that's going to set the stage for optimizing a treatment plan and helping you be in your best health. So a connection that I love to draw for patients. So when we often see, cholesterol, lipids increasing, a lot of my patients start to think about the fats that they're consuming in their diet, right? So, they'll say, well, I don't eat a lot of fats, or, I'm choosing low fat foods most often. I don't understand why my lipids are going up. And it's always a great education moment because we see that we actually need to prioritize and understand more about the carbohydrate tolerance. So how your body is actually responding to carbs and sugar, as that will have and play a greater role in what we're seeing in your lipid panel than dietary fats, right? So something we all love at this clinic is the 2-hour insulin glucose challenge to understand how insulin and glucose are responding and communicating to one another when you have a big carbohydrate or a sugar load. So understanding part of that cardiovascular risk as well is learning about your glucose metabolism, what your insulin is looking like. So that hormone that's controlling glucose, we can understand where sugars are being stored. So we'll start to learn more about your visceral adiposity, these types of markers that can really paint a really well-rounded holistic picture as to what your cardiovascular health looks like. Even if you're not coming into our office with a recent lipids panel, chances are if you're in perimenopause or menopause and hoping to discuss MHT, menopause hormone therapy, then we are doing that for you. So as Natalie mentioned, part of our risk assessment for initiating MHT, estradiol, and progesterone hormone replacement is actually doing these risk assessments anyway. So you're going to learn about your cardiovascular health, even if it hasn't been on your radar thus far.
Exactly. And we know that kind of that 1 year prior to going through that menopause transition and the year following is when we see the biggest changes on blood work. So it's really important to kind of get tested while you're kind of experiencing those maybe menstrual cycle changes. And even if you step into our office out of curiosity of what perimenopause could bring, what are the symptoms that you could experience, And what do you have to look out for? I feel like I'm having this conversation every single day. And so I like to have that conversation with patients because it's nice to know for them is that they have to pay attention to their cardiovascular risk assessment. And you kind of alluded to heart disease playing a big factor in mortality for women. And it's actually even bigger than the breast cancer, right? So we know that the cardiovascular disease for women is kind of a higher risk of death than breast cancer. And I feel like a lot of women come in with fear about breast cancer, especially if we're chatting about hormone therapy. And so that's why it's really important to have this conversation about cardiovascular risk and what that risk looks like for them. And not every single person is going to see these large changes, right, on blood work, but it is important to kind of get tested and maybe more frequent testing than you did in your reproductive years.
Absolutely. And midlife might also be a time where outside of the lipids panel that we do like to look at yearly at least for our patients, this might be where we are running things like ApoB to get more of an understanding of those exact risks when it comes to your cholesterol levels. Your medical doctor can also run a test called lipoprotein little a, LPA, and that gives you your genetic risk when it comes to cholesterol. So knowing your numbers is key when it comes to understanding what risks are involved. And doing these full assessments also help us to know what are the most useful and indicated treatment options for you. So as naturopathic doctors, we always take patients through what are those pillars, those foundational treatments and areas of health that we need to address. So of course, stress and sleep, inflammation, energy levels,
Diet and exercise,
looking through all of those areas. And then what I often call the cherry on top, but something that can really move the needle in a lot of cases, especially if we're looking at those well-known symptoms of menopause, hot flashes, night sweats, brain fog, trouble sleeping, then comes in MHT, menopause hormone therapy. So a lot of our patients ask us, can we see improvements in cholesterol levels if we take estrogen?
And the answer is you can, but it's not a reason to give MHT. We can't give it as a preventative thing for cardiovascular disease, right? That's just not something that we do. We have to use it for vasomotor symptoms that people are experiencing, like the hot flashes and the night sweats. And we actually cannot give menopausal hormone therapy if somebody's cardiovascular risk is too high, right? So we know that it can actually cause more harm than benefit if we give that hormone therapy to, let's say, for example, if the risk is greater than 7.5% on that cardiovascular risk calculation. And so we know that we have to do that calculation to see if people fall into a category that is safe to be able to prescribe. And we know that if we prescribe when that cardiovascular risk is too high, we can cause, a little bit of plaque instability that could possibly be there. And so that's why it's really important to kind of have that conversation with your healthcare practitioner and just see if you are a good candidate. And we have seen people who have had elevated LDL levels, elevated total cholesterol levels, who initiate hormone therapy. And then, 3 months, 4 months down the road, we do see a little bit of a drop. And I mean, we always have that conversation as naturopathic doctors with our patients to make sure that they're following, a low insulin demand diet, that they're participating in exercise, maybe making some lifestyle changes of lowering alcohol and all those things that impact our health. And so the combination of doing that, in addition to maybe the hormone therapy that we're on, we see those numbers drop and patients are a lot happier, they're feeling better in their bodies, and overall have a lower cardiovascular risk.
Absolutely. So there is that sweet spot. And that's what we talk to patients about too when we're doing any of the risk assessments, not only for cardiovascular health, but to understand if you are a good candidate for MHT is really understanding that, window of opportunity and that weighing that risk versus benefit analysis is really important. And like Natalie said, although estrogen therapy does not replace the need for a statin, if a patient does need that and that's the most indicated treatment for their heart health and for prevention, we still can see improvements based on that hormonal connection that we see at that time of transition in menopause, that increasing that estradiol will help with lowering the LDL as well. So while it helps, it's one of the pieces of the puzzle, right?
Today's episode is brought to you by none other than Advanced Women's Health. If you are interested in diving in deeper to your health, if you are finally ready to feel like yourself, and you are finally over hearing everything's normal, everything's fine, and you want a deeper dive into your healthcare, then we are here to help you. We are currently helping patients in British Columbia and Ontario, Canada. But don't worry, if you're in another province, still reach out, get added to the waitlist as we expand coast to coast. We cannot wait to work with you. Check out the show notes for more information on how to get started.
And let's dive in a little bit more about those tools and those indicated diet and lifestyle treatments, because I have a lot of patients that, especially if their cholesterol is just starting to creep up, or if their family doctor was the first one to notice a little bit of a jump in their cholesterol, they're often said, okay, eat clean and exercise more, and we'll see what happens before we talk about any indicated prescriptions to help manage that. So that's where naturopathic doctors come into play. So I truly believe that we are very well positioned to help you with the exact diet and lifestyle support that you need in order to make sure that we are seeing those changes translated in not only how you're feeling, but in the numbers on future blood work as well. So Natalie mentioned the low food insulin demand diet, something that regular listeners are certainly no strangers to, but let's talk about the food insulin demand and just how that can play a role in helping with lowering your cholesterol levels.
Yeah, well, it really especially helps with lowering triglyceride levels. And we know that because triglyceride is kind of that marker. That's the type of fat in the blood. It's a metabolic signal, and it really reflects the hepatic clearance or liver clearance and kind of the insulin signaling that goes on in the body. And so that's why when we're having this conversation about dietary fat and how that, could link to higher cholesterol if we're kind of eating the saturated fats and trans fats that are in like our processed foods, we also really have to pay attention to high sugar foods, high carbohydrate foods, right? And so that's why we even see a lot of vegetarians who come into our office who don't eat meat or animal products, and they still have high cholesterol and they're not understanding where it's coming from, right? And so we know that it's those simple carbohydrates that can really rise our triglyceride levels, which eventually leads to elevated LDL, which is kind of our notorious quote unquote bad cholesterol. And so just to kind of break it down and how it kind of links to our insulin, we know that we have our pancreas, which is an organ in our body that produces insulin. It's a hormone that helps to control our blood sugar levels. So it kind of takes that glucose that our body breaks our food down into, and it shifts it into the tissues and the cells in our body. And so we know that once our liver and our muscles get full of those glycogen stores, which is what our glucose is being stored into, we know that those excess glucose molecules gets shifted into fatty acids, which is then our triglycerides. And so that's why we see the rise in triglycerides when we eat simple carbohydrates and sugar. And so we really need to hone in on that conversation with patients when they're coming in with maybe elevated triglyceride levels or elevated cholesterol levels. And maybe that saturated fat and trans fats are being really limited, but the sweet tooth is there, the nighttime eating is there, and sometimes those cookies and the sugar can add up, and we can see high cholesterol levels just based on that.
Absolutely. Even multiple servings of carbs throughout the day. So we know that women become more resistant to insulin as they age. So at midlife, we're also seeing that transition time where your tolerance and what you can tolerate for carbohydrates does become less, even though it feels like you might be craving sweets and carbs more than ever. This is also, the same reasons why we start to notice midsection weight gain, difficulty losing weight or weight loss resistance. It's all connected, right? So something that we do to help target that lipid panel and make sure your cardiovascular health is in a really good place is really breaking it down and teaching our patients about what they can tolerate when it comes to insulin and glucose, using blood work and their current lifestyle to appropriately guide that, and really taking it to the food insulin demand and building a really solid personalized plan for that patient to make sure that their eating habits and meal timing, should they be fasting, should they be not, how many carbs can they have at each meal, what should protein intake look like. We're really personalizing that for patients. Another thing that we tell our patients about is fiber. So fiber is getting more of I'd say a popularity now. We know that everyone talks about protein, but we always remind our patients fiber is super important, especially for lipid levels and cholesterol health, right? So when it comes to fiber targets, I know that I share with my patients that I want them to get at least 30 grams of fiber in their diet. Patients always ask me, should they be taking a fiber supplement? My approach is foods first. So we maximize where we can get our fiber through food first. If there's any reason for us to exceed that, or if we're having a hard time, then we'll start to look into supplements if we need to. But fiber through diet is where I like to prioritize. And it's often on the prescription recommendations at someone's first visit, if that's what they're coming in for. So Natalie, should we share some of our favorite sources of fiber and what that looks like?
Do it. Yeah.
Yeah.
Favorite sources of fiber, we know that we have all vegetables are going to contain fiber, right? We know that our seeds, like, I don't know if you consider psyllium husk a food or a supplement, but I mean, that can be added to like yogurt or things like that, even like chia seeds, flax seeds, anything like oats has our beta glucans that are really helpful for that soluble fiber.
Will cut better, right? For when we're talking about insulin and glucose.
Exactly. We know that our legumes have a lot of fiber as well. And so even like our berries, right? We know that blueberries and things like that don't spike our insulin as much as a lot of other fruits. So I really encourage that as well. We know that avocado has some fiber. So even when we're kind of eating a whole food based diet, we know that we'll probably reach that 25 to 30 grams of fiber through food, right? But we need to make sure that we are incorporating those vegetables and those fiber dietary sources at each meal. And so that's why when we even talk about structuring our breakfast, lunch, and dinner, we always kind of want to structure it with our protein source, our healthy fat, and our fiber, right? And that's kind of how we structure it, just to make it super easy for patients.
Yeah, I love that. Smoothies are our favorite ways to get a serving of fiber in, especially in the morning. I know on the weekend I was with some colleagues and we were talking about how impressive raspberries are in terms of their fiber content. So they're super rich in fiber. They taste delicious. So yeah, if you're curious about how much fiber you're getting in your diet, then I encourage you all to start there and, think about, okay, what are you incorporating in each meal and how can you be more purposeful about adding in those sources of fiber that are going to help with overall, your cardiometabolic health.
And some people even wonder, how am I going to know if I'm reaching 25 to 30 grams? And I often just say you can download MyFitnessPal or another tracking app that's free of charge. And even from like a non-judgmental point of view where you're not looking at calories and you're just looking out of curiosity of how much fiber you're getting, just even if you do it for a few days, you're able to kind of do that and see what you're actually getting, because some people are surprised. They're just like, oh, I do actually eat 30 grams of fiber. That's what 30 grams looks like.
Absolutely. Let's talk about eggs since we're on the topic of diet. So that's often a big follow-up question I get, or a burning question I get from patients is, if my cholesterol levels are increasing, should I be eating eggs? Right?
Yeah. Common myth.
Yes. So what we do know about eggs, we know that the yolk is rich in cholesterol, but do we find that we really need to eliminate or reduce the intake of eggs over time to see big improvements in that cholesterol level? Not necessarily, right? Like we find that my approach is very much, let's see what we can add to your diet and restructure in terms of our insulin glucose, our low insulin demand carbs, especially, and our fiber in order to make those more impactful changes than demonizing the eggs.
Exactly. We know that for most people, moderate egg consumption doesn't significantly raise cholesterol levels. But I think it's important to note that context also matters. So eating your eggs, how it's maybe eaten in a traditional way with processed meats and simple carbohydrates, that maybe is some ways people think of eating their eggs. And so we need to switch that a little bit to maybe eating our eggs a little bit differently, cooked in like an olive oil or having it with a side of vegetables and things like that, to have an overall kind of Mediterranean diet approach when we're eating for our cardiovascular health.
I love it. And Natalie, you bring up the Mediterranean diet, which is often something that we refer patients to and educate them about, because that is such a heart healthy way of eating and one that is very achievable, especially if, you have a big family or young kids, or you're not just cooking for yourself day to day. I know that's often a roadblock for my patients is, how do I implement these changes for me when I also have a family and I have, a partner, and I have to make sure that I'm not a short order cook and, cooking 5 different meals for dinner. So even referring to the Mediterranean diet, those principles, we're usually able to find a sweet spot in terms of what actual attainable and sustainable changes can we make when it comes to diet.
Exactly. It's going to be all about focusing on our healthy fats, like our olive oil, our nuts and seeds, our avocado, pairing it with our lean proteins, right? And then kind of having that fiber as kind of our remaining content of our diet, reducing pastries, reducing processed foods, reducing alcohol consumption. And so that's kind of what the Mediterranean diet encompasses. And we know that's the most well-researched diet approach to benefit our heart health.
Absolutely. And then let's talk about movement, because movement is another important piece when we think about the lifestyle factors that can make a difference. So it's easy to not prioritize movement when you're so busy and you're stressed and you're not sleeping and you're working and you have a family to care for, and, everything else in life happens. And the last thing you want to do is dedicate time to a workout when you're just burnt out and exhausted. But when we start to give you that energy back, that motivation back, and we're giving you that quality of sleep again, then we'll find that you make time and there's space that opens up for, okay, now I actually have the energy, the motivation to actually do this workout and exercise, which makes a big difference when it comes to your heart health as well. So we do see time and time again, the research even shows us that a mix of cardio with resistance and weight training is the mix and what you want to focus on when it comes to exercise, especially at midlife. I think a lot of the information that patients get out there, they say, don't do cardio for too long because it'll raise your cortisol, a lot of these myths out there. But when it comes to what your body needs, we need that healthy mix of cardio and weight resistance training really to get to the optimal health that you need, even if there is weight to lose, especially working on your heart health. This is the mix that we need to see.
For sure. We need to see kind of that 150 minutes of moderate intensity exercise per week. And I would love if patients were weightlifting 2 to 3 times a week. We know that muscle degeneration happens, especially as we kind of are at this age during midlife. And so in order to prevent that, we need to challenge our muscles and lift heavier weights that's progressive, and mix that with eating enough protein to make sure our muscles stay strong is going to help our bodies stay healthy, active, and kind of have that optimal health and longevity.
Love it. So big takeaways from today's episode. I think what, Natalie and I would love you guys to know is, if you start to see your cholesterol flagged on your blood work, don't panic. Before you start to panic and go down that Google rabbit hole, pause, see your trusted healthcare provider, see a naturopathic doctor, bring that blood work and start to think about, what information do you need? What does that risk assessment look like? And how can we really make some impactful changes at midlife to make sure that we're setting your heart health up for the best that it can be for the decades to come? And really leveraging our diet and lifestyle advice, getting that movement in, making sure you're sleeping well, you have great energy, all that good stuff. Digestion is working well. And then talking about MHT, menopause hormone therapy, and if that is a tool that can also be used at this point in time to help support your menopausal symptoms and your menopause transition, but how that might actually impact your cardiovascular health as well.
Exactly. And just knowing that this is the opportunity to kind of look at your cardiovascular risk at the moment, go and get your lipid panel checked from your healthcare provider. And then you can always have a baseline, even if you're kind of slightly entering perimenopause or not there yet. We know that having that baseline and then kind of that comparison, maybe when our estrogen kind of dips a little bit, is going to be really important, just to have an overall assessment and understanding of your body.
Absolutely. Know your numbers. Knowledge is power, and it helps to set you up for the next stages to come.
Exactly.
Awesome. Well, thanks for joining us today, everyone. We hope that you were able to get some great takeaways from the episode, and we look forward to seeing you again next time.
Thank you so much for listening. I hope that you had as much fun as we did. And if you loved today's episode, share it with a friend and leave us a review. That is how we spread this message, and that is how we are going to revolutionize healthcare in Canada for women. Have a beautiful day and be well.